Brownstein. If a person has no gallbladder, how are they going to increase their cholesterol levels?
Well, most of the cholesterol is produced in the liver. So detoxing the liver can help.
No, I wouldn't have one.
Bring
it to the boys
upstairs. Increase their cholesterol levels with or without a gallbladder.
So how do you detox the liver?
Depends on what you detoxify from. First thing is trying to identify what you want to get rid of, and then use specific things for that. So there's different tests you can do to try to figure out what is interfering with liver metabolism.
Okay, so do a complete panel of liver metabolism.
A workup, a nutritional workup and a toxicity workup, and I think you can do a better detox if you identify what you're detoxing from.
Okay, thank you.
Along these lines, so are you saying detoxifying the liver will help improve your cholesterol level?
So most of the body's cholesterol is produced in the liver. A healthier liver will produce more cholesterol than those that underproduce it. And interestingly, a healthier liver will lower cholesterol in those that are producing too much cholesterol. Cholesterol is an anti-inflammatory agent, so if there's inflammation in the body and in the liver, sometimes cholesterol levels will go up. Decreasing that inflammation level will naturally lower cholesterol levels down.
And somebody who has too little, it will have the opposite effect?
It's almost like an adaptogenic effect. I mean, if it's too little, it'll come up. If it's too high, it'll come down. The too little ones is a little bit harder. Sometimes those are harder to get up. The too high ones can come down, which is doing some basic holistic parameters. To increase low cholesterol, that's some of the hardest things I've had in some patients. I've been unsuccessful in some patients for doing that.
I was at my cardiologist and I discussed with him nitric oxide. And he said the only concern that he has is he has seen occasionally people who are on higher doses of nitric oxide and they have a cardiovascular accident, they have difficulty resuscitating from this phenomenon.
Well, there are a couple studies now, actually 3, that show if you administer L-arginine to a patient who has advanced endothelial dysfunction, or in fact these studies were more specific in that if you've had a cardiovascular incident, you will increase the mortality of the patient. So this was a contraindication for the use of L-arginine. But how that's happening is that system, that enzyme, when it's uncoupled, will actually use L-arginine. I'm talking about the nitric oxide synthase enzyme, which is part of the L-arginine pathway, and a primary pathway, will take L-arginine and convert it to superoxide. So we're actually increasing oxidative stress in the system when we're administering L-arginine to a patient with an uncoupled enzyme system. And that depends on how high that oxidative stress level is, the more inflammation. They're producing a lot of superoxide in the system. This is one of the contributions. Did that answer it?
Yep.
Just an observation, I guess it's for Dr. Brownstein. I've been in regarding the nitric oxide thing. I've been in practice 38 years, and I have yet to have one man ask me if I'm healthy enough to have sex, and also I've never seen anybody with a 4-hour erection. I just wonder if that's just something of commercials.
Yeah, so one other thing on the low cholesterol lady question. I had really low cholesterol levels about 15 years ago when I checked them, about 110, and I was not happy with that. And in further testing, my mercury levels were the highest that I'd seen in my practice and would now rank number 2 in my practice. I was eating a can of tuna fish every single day for 15 or 20 years for lunch because that's what I like to eat every day. I stopped that, I detoxed from mercury, my cholesterol pops right up to 180 to 190.
Would you elaborate on how you detox?
So I detox from mercury using DMPS and EDTA. I used IV DMPS, oral EDTA, and then lipoic acid, MSM, and a few other items with occasional nutrient IVs. And those were the big things that I did. I used DMPS IVs about once a week for about 8 or 9 weeks and followed my levels down when I was checking the challenge test about every 2 weeks.
Dr. Perry, you spoke about autism and you also mentioned tics. Are you aware of information that there are amalgams and the instance of Tourette's syndrome with involuntary motions or Tourette's syndrome with tics, and you associate tics along with autism and a couple of other things with exposure to amalgams?
Just speak closer to
I did not specifically look at amalgams and Tourette's syndrome. We mostly look at large databases, and we looked at thimerosal. And mercury in thimerosal is definitely associated with tics. But one of the things, like David wanted me to point out, a very, very small percentage of kids with tics actually just have tics. 90% of them have symptoms of either autism-like symptoms or ADHD-like symptoms. And we find that all three are associated with mercury. But I did not specifically look at amalgams and Tourette's syndrome. But that would be something definitely that I would want to look into now that you bring it up.
Can I ask a question of anybody in this audience? In the conference we just had, the FAN conference in Crystal City, one of the things that we heard from Jennifer Luke. Jennifer Luke is a dentist from England. She did research on the pineal gland, found that fluoride accumulates in the calcifying part of the pineal gland. What she reported at the conference, which actually blew my mind, she said that children with autism didn't produce melatonin. Is that not right?
That's correct.
That's good. But this is amazing. I mean, I don't think the rate that autism has increased could possibly parallel the use of fluoride in drinking water. But I'm just wondering if it's a compounding factor. Because there are two parts to her study. Number one, she got cadavers and showed that fluoride accumulated in the pineal gland on the calcifying tissues. The average was about 9,000 parts per million. It went up as high as 21,000 parts per million. This is astronomical. These levels are higher than somebody with skeletal fluorosis. These were elderly people. Then she looked at animals, and the animal of choice was the Mongolian gerbil. And in her animals, she found lower, between the high fluoride and lower fluoride exposure, lower melatonin production, and earlier onset of puberty, which is consistent with that. And one of the other things that she stressed, which I think is interesting, she reckons that was the first time that somebody had mimicked bottle feeding. Because when the pups were born, she would very carefully deliver the fluoride in the water by little teat pipette to the child. But I don't know if anybody is familiar with autism or some of the biochemistry that might be going on. Would this add another dynamic to this?
I'm dynamic, but I don't know anything about it.
A lot of the parents supplement their children with melatonin because they just have terrible quick sleeping problems if they don't get melatonin.
And they certainly have autistic certainly have precocious puberty.
Have what?
Precocious puberty.
I have one more question. Dr. Haley, you talked about the toxicity of mercury, and I was reflecting back on the case of that Dartmouth researcher in 1997 that had one drop of diethyl mercury on her glove finger. She immediately stripped it off, washed her hands, and was chelated, and she was dead 6 months later.
That was my thesis of that.
Well, could one of you explain what the mechanism is that could cause one drop of mercury to result in this woman's death because of the minimal exposure, supposedly?
Well, what she did was, the toxin there was dimethyl mercury. I mean, dimethyl, and then the penetration into the hydrophobic aspects of the body and into the nervous system would be a lot faster. I haven't been privy to her mercury levels, but they used that particular compound to modify DNA, and I think that's what she was doing.
Yeah.
And so it can be incredibly toxic and cause permanent changes to your DNA.
Well, this relates to what you were saying, Boyd, because they had scientists all over the world trying to get the mercury out of her body. They could get it out of her blood, they couldn't get it out of her brain.
But that's such a small amount of mercury.
No, but what you have to remember is the amount. It's everything is relative. I mean, because we've worked with things like thimerosal. I mean, you know, if you had just a few flights of thimerosal on your hand and you could barely see it, it would go right through your skin. It would kill you as well. I mean, we're talking about for the organic mercuries, and this is where there's a difference between what's in an amalgam filling and what's in the organic mercuries. The organic mercuries at, you know, a few milligram amounts, even as us as an adult, very, very likely you're going to get sick and probably die. Whereas, of course, in the fillings, you're talking about gram amounts, but at least it's metallic mercury. Yes, it off-gases and does all the terrible things. But organic mercury, membranes, skin, lungs, those kind of things are no protection at all. Zero.
And, you know, if you're talking about, I know more about thimerosal, but thimerosal is soluble 1 gram of water, 1 gram of thimerosal. So if a drop was a quarter of a cc, it could be a quarter of a gram.
Of organic
Of organic mercury. That's enough to kill more than one person, multiple people. We're talking about the toxicity of thimerosal is toxic at less than 1 part per billion. That's, for those who wanted an example, that's if you take a grain of salt out of your salt shaker and put it in a swimming pool. That will kill human neurons at that level. So it may sound like a small amount as it's a drop, but if it's a drop of pure organic mercury, that's more than enough to kill it.
Just want all of you to read the paper on office deletions where they put the thimerosal on the tummy skins of the children and killed 10 and 13. But when they did the autopsy, go read the paper and look at the level of mercury that got into some of the organs. I mean, from the skin. So ethyl mercury, organic mercury, can be incredibly soluble in your body, and it can concentrate in certain organs. There was one person that had 100,000 parts per million. That's an incredible amount to absorb from your skin. And it also tells you that children do not have the ability to excrete it. And this lady, it would be interesting to go back and do a genetic study on her now to see what was her ability to excrete mercury. I mean, did she have some of these polymorphisms that render you not very capable?
Again, on the amount, it's so easy to think. In the UN, the Africans were told that the mercury in vaccines was a very small amount, and they invited us to answer. And they said it was a teeny amount. As a matter of fact, it's a teeny amount. In fact, you can't even see it. We're talking about full dose thimerosal is 25 micrograms of mercury. Just think of how many micrograms there could be in a drop of pure organic mercury. You know, it sounds small. It's absolutely amazing. This stuff is more toxic than anything you can imagine.
Ladies, I don't have a question, but I want to let you know that my brain is full. Thank you so much for teaching. We really appreciate you, and I'm here to offer you some refreshments if you'd like one. And can I do that for you? I don't want to be too serious here now.
You're checking for vitamin D levels in all the patients that come in. Are you doing that also for patients that you need also to be checking what allows vitamin D to get in? That's other elements.
I mean, I don't just check vitamin D levels in every patient. I do a lot of blood work in every patient, and I do check magnesium and vitamin A and vitamin K and some of the other cofactor levels. mean, I've been doing, you know, I would say 20 plus years of this. So it's not just checking vitamin D levels and everything.
Yeah, I mean, that's a routine check that you do. Are the doctors not checking for magnesium, for example, because it's not typical check?
I would imagine the doctors here are checking blood work, are checking for it. I mean, none of the conventional doctors are doing it. I mean, they just started doing vitamin A recently, but you know, that's all they do. They don't check for the other stuff.
Right, right. Are you thinking about checking for, as a lot of tests that you do, also magnesium level, because it's...
Everybody gets a magnesium, RBC and urine magnesium level testing.
It's not a typical test that you do with the labs.
It is a tip. Quest Lab does the test. LabCorp does the test.
You have to do an RBC.
You do RBC testing.
Dr. Sprini, you said that nitrite was what converted to nitric oxide. So I want to know, in meats that are cured with nitrite, why are they so bad if that's what converts to nitric oxide?
I knew this question was going to come up because we're at this crossroads right now. But of course, the nitrite is added to the meats to prevent microbial overgrowth. And you can actually see the meat turn red, that bright red color, which is a reaction with myoglobin when nitric oxide combines with a heating group. So those, what we call misconceptions now, started with testing that was done in animals, very few tests long ago. In fact, Dr. Bryan goes into those in his textbook on nitrates and nitrites. But now those tests are considered invalid because of the way they were performed. But just in defense of all that, I would say that the way this chemistry of nitric oxide, nitrates and nitrites is so complicated. And yes, those nitrogenous compounds can go in many different directions in the body. So that's why they add vitamin C now along with it, to keep that nitrite from becoming nitrosamine, which they've, you know, we know that it can cause cancer, but in the setting that they proved that it could cause cancer, that those tests were not considered to be well performed. Let me put it that way. So we missed a whole era of more, we didn't know. We didn't know this kind of chemistry. We're just learning it all right now. And so in a healthy person, or nitrates coming from a plant source that has all of its supporting nutrients along with it, that's not a likely thing to happen. So, you know, when you take an ingredient like that and you put it in a different setting and you don't support it, you can get lots of different kinds of nitrogenous chemistry, you know, nitrosation, or those kind of reactions. So we don't really have any good studies to really support whether cured meats are in actuality causing cancer in humans, stomach cancer. So all we have is animal studies that were poorly designed. But since then, we've been able to show, at that time we didn't even know that we converted to nitrate. We didn't even know nitrate was part of, there was a human nitrogen cycle. So we didn't, nitric oxide wasn't even discovered. So there's much to learn every single day.
So in other words, it might not be so bad.
Right. As a matter of fact,
Just
I would
don't know
say,
yet.
if you want to weigh the risk, consider foodborne illness, you know, and the fact that those ingredients, I mean, those additives are preventing, you know, oxidation. So not just antimicrobial effects. So you know, this is something to really think about. I mean, before I knew about nitric oxide, I went out of my way to buy uncured meat, but now I look for it. I'll tell the butcher, make sure it's cured. I want to make sure it has nitrates and nitrites in it. And he just looks at me like I'm going to protect my family, make sure that they don't, because there's just too much foodborne illness going on right now. And factory processed meat, if you look at it a little bit closer, it has a fear aspect to it, so.
All right, this is going to be one of those great questions I always ask, but unfortunately, we always try to kill bad bugs in the mouth. You express the fact that if we do that, we can't continue this process. What am I supposed to give my patients?
I figured that question would come up too. Well, so we now know this, so now we have to shift. So we have not studied everything. We know there's a study on chlorhexidine. 7-day use of chlorhexidine has been shown to raise blood pressure. I know I've read another study talking about amoxicillin that does kill the bacteria that we're talking about. But have we tested alcohol mouthwashes? No. What about hydrogen peroxide in the mouth? We don't know yet. We don't know. I was just saying that antimicrobial mouthwashes are something to be really careful, because we know chlorhexidine at least is definitely killing these bacteria off. So that's why that study that I presented has opened this whole world of investigation. So we should have some answers for y'all soon, because we need to start now looking at, now that we know the bacteria that have the nitrate reductase enzyme, now we can test them against different types of, oral types of mouthwashes, or bacteriostatic, not necessarily bactericidal agents, maybe. But the other point is, if you can raise the nitric oxide and create a healthier gum, and the extracellular matrix, all of that function, then perhaps there'll be less bacterial imbalance in the mouth. We can keep these opportunists from becoming pathogens in the mouth. So I'm suggesting that if we can get better nitric oxide to the mouth, and we can, then maybe we can, you wouldn't have to. You wouldn't have to resort to that, because we could lower the risk for periodontal disease.
Along the same line, there are in the dental world now oral probiotics. Are you familiar with any of them, and are any of them helpful in establishing the oral commensal bacteria?
Right. Well, what that study showed is that these bacteria are truly anaerobic. They're either facultative anaerobic, which means they're not so strict that a little oxygen will immediately kill them, but they are obligate in that you're going to also find anaerobes that can't tolerate air at all. Those are not the type of probiotics that are being, administered. So, but I was also talking about most probiotics contain lactobacilli, and in that study it showed that.
I'm not talking about oral probiotics. They're the whole brand now of oral.
Right, but I've seen some of them. Like I have a toothpaste at home that is from, I believe, Designs for Health, that actually has a genus and species, lactobacillus. But even oral, I've seen lactobacilli in the mix. So, in this study, it showed that one of two things are going on, because where the lactobacillus was in the community, that community showed less ability to reduce nitrate. And in fact, the more lactobacilli that were present, the worse nitrate reduction was taking place. And on that chart, it shows you best reducers, intermediate, worst. So they speculated, the researchers, that number one, either the lactobacillus were emitting something or producing a substance that was affecting the community's ability to reduce nitrate because it was, predominant, or it's just genetically a poor nitrate reducing, species or genus and species. So they're not sure. It was just a observation.
How about strep salivarius? Something along that line.
There were a lot of streptococci that were in the nitrate reducing category. So we just have to, and those are microaerophilic, meaning that they can exist, they can grow in an anaerobic situation, but they can definitely, they're aerotolerant. So, but some definitely, they weren't in the best, but they did. Most bacteria can reduce nitrate all the way down to N2. So in order to really create a therapeutic, which is really what these studies are designed to do and where we're working on it, then we have to be able to identify the strong nitrate reducers and not use the bacteria that have nitrate reduction, nitrite reduction, nitric oxide, we have to just focus on this one aspect, because what the goal is here is to be able to produce a lot of nitrite in the saliva. Nitrite is how the body store nitrite. If this process is going on in the mouth, the end result is that we have better blood and tissue levels of nitrite, and we store nitrite predominantly in the skin, about 70%. And then when you go out and you're exposed to UVA radiation, you start producing nitric oxide. That's cutaneous immunity. That's one of the ways we protect ourselves through our skin. There's also nitrite in the myocardium and skeletal muscle. It's bound to other proteins in the body. But our goal is to try to get people to have good nitrite levels, because that is what will protect you when you ever experience drops in oxygen tension, which could be going on all day, or as we start to develop more occlusion or plaque development, we're experiencing more hypoxia. Well, if we could build these nitrite levels in the tissue, anytime our body experiences a bout of hypoxia, that is the stimulus for nitrite to convert to nitric oxide. So we have a way to continuously produce nitric oxide through this pathway. So we want more nitrite. So we want to really encourage the growth of the bacteria that are going to give us this protection from cardiovascular disease, give a cardioprotective benefit. And that's really the long-term goal of these studies. The short term, we're going to identify them. The long-term goal is to produce a therapeutic that will repopulate or colonize the mouth with the right kinds of bacteria in an effort to lower the risk of heart disease and maybe ameliorate it. So we want to, that's what these studies are all about. But we don't know everything. We're just opening doors. When it comes to nitric oxide chemistry, it's all new. We've got a long way to go. But thanks for the question.
This is for Boyd. Just wondering if there's any estimate when you might have a product, and is there a way we could politically or financially help the process?
You know, send me all the money you want. But really, the thing is slowing it down. I can tell you where it is. We've gone through the phase 1, giving 600 milligrams a day, not a single adverse effect was noted, including all of them that you might expect with a chelator. None of them showed up. But we have to do a phase 2. I mean, it's a regulatory thing. We have to show that we can take a mercury toxic subject, 20 of them at least, and show that we can lower the mercury levels and make them healthier. And to find the people that I think that the EMA will accept, we have to go to some gold mining place in South America or Africa. And that takes time. And the worst thing is, if you've ever, and I know most of you have dealt with some regulators, you fill out a form, you have to do everything. I mean, it's just like Mother May I with a drunk. So I would tell you that at least by 2017, it should be out if everything goes as slow as everybody predicts it will go. But it's setting, and Ragnar Klingberg, some of you met him, he's a very clever guy, and he has got some licenses, and in Sweden the license is if someone is treating people with Wilson's disease, which is a copper toxicity, if they can apply, as soon as we get the thing in our hand that says what we know it's going to say, that phase 1 is done and complete and no toxic effects observed, then the people that are treating people that have they're called No, where you're trying, where you're compassionate use, where they have no availability of anything that will make them better, that they can test this. And I think if they test this, they're going to be shocked. Wilson's disease, thalassemia, and everything like that. Now, what will happen politically if it does, if they do get the license approved, and if they do use it, and if it does work, I think it will go a lot faster.
No. This question goes to each of the panel members. So, because I kind of sense there was an underlying theme about protecting the next generation.
Louder.
Can't hear you.
I kind of sense that there was an underlying theme here of protecting the next generation as we were going through this. But just going to the panel members, we get patients coming in who are pregnant or whether or not, from your perspective, what you would say are some of the important issues or things that they should be looking at in order to protect their children going forward.
Okay, in terms of nitric oxide, we now know that preeclampsia is a nitric oxide deficiency problem. And I don't know if I'm at liberty to say, but there's a clinical trial under investigation right now that is looking at, and we've actually given nitric oxide donors to women with preeclampsia, and these women have been able to go full term. So right there, we want to check the nitric oxide levels of pregnant women before they get into a situation where they're pre-hypertensive and then hypertensive to the point where their children have to be born premature. So, is that okay? Yeah, okay.
Clearly, in my case, no fluoride tablets for pregnant women, no fluoride tablets for babies, and if you bottom feed your baby instead of breastfeeding your baby, then use non-fluoridated water.
It'll be much healthier if they take statin drugs at the beginning of pregnancy. I know statin drugs. It's on tape, so that's just a joke. I guess if there's one thing I would say for a pregnant woman, it's iodine. Studies are clear that iodine influences the baby's IQ, and it may influence the baby's IQ for life. You know, if the mother is iodine deficient during pregnancy. And if my numbers are right, after testing over 6,000 people, and 96+% of people deficient in iodine, the vast majority severely deficient in iodine, we got a major health crisis going on that, you know, it's just not being recognized right now. So that's what I would vote for, is I guess the single thing.
And can I just piggyback on that? There's one study, I told you about the Harvard Review, there's one study in there where the high fluoride village was 0.88 parts per million, and that was because there was also borderline iodine deficiency. So there's every reason to believe that if the patient is borderline iodine deficient, the last thing they need is fluoride. It makes it work.
I would go with what I know, and I learned, not for the first time, but what Dr. Bronstein talked about earlier. I read an article said, get your flu vaccine, it decreases your risk of getting the flu by 65%. And that meant out of 100, if you didn't get the flu vaccine, you had a 2.65 chance, or 1.65 chance of getting the flu. And if you didn't have the vaccine, if you got the vaccine, it went down to 1 per 100. So, you know, you say 0.65%, and I don't even trust the guys that did the counting. Anytime somebody makes that kind of argument, you know they're trying to gild the lily. I would just say, make it well known to everybody, your children, your grandchildren, and everybody you know, do not take any vaccine that has thimerosal in it. Just absolutely don't do that. It's nothing, I mean, injecting a toxin, something as potent as thimerosal in the body, as witnessed by some of my colleagues to my right. I mean, you gotta be an idiot. Our government absolutely fits the description of an idiot.
Should have gone the other direction, to mine, but I would go as a person that worked peripherally and essentially in OBGYN at Hopkins and then did amnio for years. And I certainly would not take a vaccine when I was pregnant or any time with thimerosal, but I also would doubt taking any vaccine during pregnancy. We have taught pregnant women and our OBs, and again, there's a lot of resistance, you know. They're having trouble getting them to take it because the OBs that we all we're trained that when you're pregnant, you take nothing because we don't know the effect of any of them unless you absolutely have to. And I used to have pregnant women call me and said they had a headache. Should they take an aspirin? And my answer would be, could you make it through the night without the aspirin for your baby? Nobody took an aspirin. And I think aspirin's probably safe, but I wouldn't take it unless it was desperation. We don't want to mess with pregnancies in areas that we don't know. So I would certainly not give any vaccine to pregnant women.
Does that include ABO compatibility?
No, I think Rogam needs to be given certainly after birth if you're going to have more children. I mean, that's a very good question. I took care of a lot of Rogam RH negative problems, and that's very severe. So I think, but you know, and then, by the way, I don't know if anybody knows, but Rogam used to contain thimerosal, and it used to come in single syringes, and it had thimerosal higher than the vaccines, and I used to give it. And every time I did an amnio on someone that was RH negative, where the father was RH positive, so I undoubtedly caused them a lot of autism. I don't think that's right. I don't think it's in there now, but I think they're fooling people. By the way, you might ask why it was in there. It's supposed to be not in single-dose vials because there's no problem with contamination. They weren't sure the Rogam was sterile to begin with. That's why they put it in.
Shouldn't we be all treated like we're pregnant?
Are you telling us something?
Arnold.
It's interesting. I have a very different answer, I guess, than everybody else. Being maybe younger, my great concern, because I've done this with Janet, we did urinary porphyrin testing on American children. We did it by comparison on French children. We published this a couple of years ago, and when we did that, we found the American children's porphyrin profiles were much worse than the ones in France, particularly for heavy metals. I think anybody, children, adults, anybody that's seeing a doctor, probably the number one thing I would do is a urinary porphyrin test to see what's your toxic load right now. That's without any drugs, that's without any intervention. Just collect the first morning urine, make sure it's protected from light, and send it off to LabCorp Quest. If you want more intensive testing, Laboratory Philippe Auguste in France, and see what's your status. Are you mercury toxic? Are you aluminum toxic? Arsenic? Any kind of number of things. And then address it accordingly, either remove the exposures, treat it, and then think about having children.
I think that pregnant women should consider all sources of mercury and eliminate all as best you can, including fish. And then I would ask the dentist, I had a friend who had her mountains out while she was pregnant. I personally, you all can tell me if you think differently, you need to wait.
Hello.
Okay, not too long, because I know her child was born with pervasive ductal disorder, and she regrets having her mountains out while she was pregnant. So I think we should need to look at all sources of mercury, not have any.
Did she have enough safe?
Probably not.
Probably not. Having had 18 fillings in my mouth when I carried my daughter, and my daughter is now schizophrenic and bipolar, and my second son, we're not so sure about what he is yet. We don't have his diagnosis. I would say no. Make sure that they're super, super, super taken out safely. Because every day that you're breathing in mercury vapor from your mouth, you're passing it on to the baby. And then when the baby's born, well, then everybody wants to breastfeed. And if you're breastfeeding, you're going to give more mercury to that baby. So the sooner you get the fillings taken out, when people call my office, I say the best time to take it out was yesterday. But under very, very safe precautions.
I doubt she did it under safe.
Yeah. Even safe is never pure.
Yeah, one question, I'm not sure who to answer.
None of us are that good.
But one more question. Can any of you comment on some of the research
researched in the past, we were Schreiber started this from the UK, on the effects of the DPT vaccine in sudden infant death.
My father and I studied that extensively.
Louder, please.
My father and I studied this extensively in our past history. You wanted to start?
I worked with the Vaccine Compensation Act for a very long time. And the Vaccine Compensation Act used to compensate those children that died within 3 days with DPT shots. Wholesale DPT, which is what they were using. They admitted, in other words, that it caused death. I believed at the time, clearly, that DPT, I mean, you had people that went into seizures and died in the office. I mean, it's clear, it's absolutely clear that some children died because of this. But it never occurred to me that it was a significant cause of critical death, caught death, sudden infant death. However, later on in our research, we know it was a significant cause, and we even have a good estimate of how many tens of thousands of children they murdered with this.
And what my father is talking about is that the United States did an incredible experiment, which was that in 1991, early 1992, there was an introduction of acellular pertussis, the so-called purified vaccine. It was toxoided. They removed the poisons.
It took me 20 years of suing them and publishing them to get them to do it.
Subsequently, by 1996, the acellular vaccine was recommended for all the vaccines given to children. And by 2000, there was no longer any wholesale on the U.S. market. And so because of that slow, gradual transition, we were able to study the effect of introduction of acellular pertussis vaccine on the rate of deaths in American children. And what we found is that about 50% of all the so-called SIDS deaths, crop deaths, CRIS deaths, were due to the wholesale pertussis vaccine. The government apparently was pretty aware of this issue because in 1994 they began what was called the Back to Sleep program. This is the program where they told moms, put your child, your infant child on their back, not on their stomach, and that this would prevent them from suffocating themselves. And so the authorities try to say that the reduction in the 1990s of deaths, and it was about 50% in the United States, was due to this program. In our studies, we can compare the kids who got wholesale versus acellular. What did they do? Not tell the moms in the wholesale group?
It only worked in those who had the acellular. But it gets worse than that. There's better group.
And so that was in the United States. In Africa and a number of the countries there, the drug companies actually did testing. They were doing villages where they would go into a series of villages. They would give them wholesale pertussis vaccine, and other villagers got no vaccine, and they measured the deaths in the kids in the villages in Africa, and they made what are called survival curves. So they plotted out in the first couple of months of life how many deaths occurred in the kids who were going to get wholesale versus those who got no vaccine. There was no difference in the number of infant deaths. Starting at 2 months of age, that's when DTP is given, all of a sudden the ones who got the wholesale started dying more and more and more. And so it caused this big bubble, divergence in the deaths between the two groups. And the vaccines given at 2, 4, 6 months of age, during that time there was a 50% difference. By age 1, that bubble disappeared. The ones who got wholesale versus not, there was no difference in deaths. So unfortunately in this country and around the world, a major cause of SIDS was and is wholesale pertussis.
And it gets worse. You might say, well, maybe they didn't know that, and they just happened to do the Back to Sleep program, okay, and maybe it just looks like it covers it. Then there was England. England continued to use wholesale DPT until 2004. And in 2004, the English BBC put out, by the way, that they were going to quit using wholesale anti-marisol because they thought it was causing autism. I mean, that's their official position. But in that very year, the English adopted the Back to Sleep program because they knew that they were going to see a drop in SIDS and they had to cover it up. And interesting enough, we've even looked at further. It turns out that that's the major cause of SIDS from DPT, but there's a minor cause.
And what we've seen is that actually looking at tracking SIDS deaths, there was the reduction that occurred in the 90s, and then for some according to the authorities, unknown reasons starting around 2002, 2003, 2004, there was a further decrease that occurred. We've done studies and looked at this. That correlates when they removed thimerosal from the DPTs and the HIVs and the hepatitis B shots. So it looks like apparently thimerosal, while not as big as whole cell pertussis, was also contributing to SIDS deaths in kids.
And we gave a talk on this once, and we dedicated it to those who died needlessly. But if you start thinking about the SIDS rate, and you allow a simple calculation, this isn't exactly right, but it's easy. If you allow that SIDS is 1 in 1,000, and there's 4 million deaths, 4 million births a year, okay? And they knew this since about 1980. So if it cuts it in half and it's 1%, that's 4,400,000. That would be 40,000 per year. We're right. That's 50%. 40,000 a year for 20 years. Almost 1 million children died needlessly, and they knew it, and they didn't stop it. They're criminals.
Is the research into pertussis related to the acellular? The whooping cough that's picked up, is it change in the vaccine?
You mean why is there more whooping cough?
Yes.
There's several reasons. One is,
What was the question?
Why is there more whooping cough now than, say, in the late 1990s? And there's several reasons. One is, when they switched to acellular, by the way, everybody know what I'm talking about, acellular whole cell? The whole cell was pertussis whooping cough. They grew the bug, they killed it, they injected in your arm. Full of endotoxin, DNA, RNA, proteins, you name it, pertussis toxin, adenyl cyclase, all the poisons that are in that vaccine, that organism. Acellular means you purify out the antigen, which happens to be pertussis toxin, toxoid it by damaging the molecule so that it's still antigenic, and they do it, by the way, usually with formaldehyde or glutaldehyde, and then using that. When you did that, in the old days on whole cell pertussis, every couple years, they would isolate the ongoing strains of pertussis. Typically, the whole cell DPT contained a mixture of 10, 12, 14 different strains. When they went to acellular, I guess because it was a more defined product, they picked the strain they were using, and they haven't changed it since. So guess what? As time goes on, the perfectly good vaccine now has the wrong strain. So that's one of the reasons. The other reason is, of course, they would like to scare the public, and they do it by changing the definition of pertussis. You may think that when they say there's X number of cases of pertussis, that's pretty easy to tell. Well, the word pertussis or whooping cough, the old name for that was the 100-day cough. The current definition for pertussis is if you have culturable or PCR identifiable organism in your throat first. And by the way, in case you think that's rare, it's 30 to 50% of the population carry that. And the second one is you cough for 5 days. Well, I'm not convinced that some of those people who cough for 5 days who have it in their throat have pertussis. In fact, some of the ones they show on television obviously don't, and they don't even know what pertussis is. It's whooping cough because, at least in young children, it has an amazing sound. If you ever heard it, you'll never forget it. And they got kids that are coughing, you know what I mean? Coughing like regular coughing. And I always teased my partner, John Young, Dr. Young, who, for some reason, every winter he has coughs, 5, 10 days. And I always told him, if you get cultured, you're in the 50%, you undoubtedly have pertussis every year. I mean, that's not pertussis. Some of them may be, but you got to cough for a long time, a really long time. You got to have an unusual cough. So now they got lots of cases. In fact, they published in the New England Journal, this is wild, that there were 1 million active full cases of pertussis on the average year. 1 million. By the way, it's reportable. And the reports are, at that time they were a handful. Now maybe it's in the hundreds or 1,000. So, they can make it anything they want. And they're trying to scare people. Pertussis is not a great disease, but I would remind people it's treatable by antibiotics.
Yeah, y'all, if we go till 6:30, that'll be an hour, so we gotta get ready for the party. Yeah?
Hello.
We want to join them.
So thank you for your time. Every one of you guys that have talked this weekend have said things that have actually affected my life. So I'll start just real quick. My wife, thyroid deficient. took fluoride pills during first pregnancy. Kid had problems sleeping throughout the whole childhood. The sleep specialist is not here that I was talking about, but we've gone through a lot of different things. He was vaccinated, and so now that I'm going through all the stuff that you guys are talking about as far as what's happening, what could it be, because I've been on this track as far as figuring out what to do with tonsils because it goes bad. Like somebody said, take the tonsils out. Sleep studies have been done. Okay, he's got some sleep apnea issues or whatnot. And then I came across about fluoride causing IQ issues. And then, so I guess my question is, kid is bright. I mean, he's hyperactive. We have our challenges with him. We've taken him to professionals as far as, quote unquote, how do you label him, you know? But he struggles, but he pulls through. So my question is, you guys talk about a lot of stuff. How do you detox a kid that has perhaps thimerosal, mercury, fluoride? Is it the same as adults? Is it doable? How do you do that? Is that a loaded question?
Well, I'm envious of the people that deal with metal toxicity, positive ions, because there's a whole array of these chelating agents. But no one's come forward with a whole array of agents that do the same for negative ions. So I have heard people talk about certain clays that may have pockets that will attract a negative ion. I like the sound of it in theory, because that means the fluoride would go into the clay, and the clay would exit in the feces. So I don't know if anybody knows of any clays or whatever that will remove negative ions as opposed to positive ions.
Because you spoke about ADHD kids and all these. I mean, that's a lot of kids. How old? He's 11 now, and we have a lot of struggle with school with him. Like even from
gets easily frustrated.
Yeah, I mean a lot of the stuff that you talked about, from sleep to frustration to lack of attention, struggles with school, but then pulls A at the end of the semesters. So I mean, it's like we're amazed as how he's, able to pull through, but we have our struggles with him.
Is he aggressive?
Aggressive.
What's his status, history of puberty? Because a lot of these kids have early puberty, high testosterone, are aggressive, and testosterone causes behavior problems and causes them not to be able to think for them.
I don't know what exactly you call puberty, but I mean he's got hairs coming up here and he's got a little bit of a hair down there, but he doesn't have any voice changes or so that I'm not sure.
I can't comment on your son, but a lot of the kids have early puberty signs.
My father's talking about children with neurodevelopmental disabilities. We can't do a diagnosis from here on the stage, but
no, I know. I'm just saying,
it fits very much with what
everybody was talking.
What we've been studying a lot.
So I guess my frustration is I've been all these years. I go from one place to another. Like he was mentioning that, we all practice. We learn things and we practice with other people, but when it comes to our own kids, like remove tonsils. Well, why would you want to remove tonsils if you can inject them with ozone or something that is a little bit more conservative? And I'm not asking you to diagnose, but I'm wondering, so how do we detox these kids?
Well, here's what I would say. Number one, go find a doctor who deals with this, let him do an evaluation, and find out what you're detoxing from. And for negative ions, I can tell you the two best things for negative ions are iodine and salt, by far. What's bromide and fluoride, you can measure it in challenge tests, and you can see levels come out, and clinically people seem to get better with doing this. And salt is the key part of it. Well, they're both the key part, but it will not work without adequate amounts of salt.
Regular salt.
So the second major constituent of the body is salt. Next to water, we need salt for hundreds, if not thousands of different reactions in the body. You need salt for detox. And when you give someone iodine, they're going to displace bromide, maybe fluoride, and to pull that out of the body, they're going to have salt to usher that out of the body. And without salt, I see problems develop where people are putting iodine in it.
Do you know,
Potentially.
do you guys, from the MDs that are practicing these type of things, do you have an organization or a collection of people that you feel comfortable to refer to California, so-and-so is somebody that you can work with? Or
I mean, there's a group, ICIM, International College of Integrative Medicine, that is a group similar to this group, where, you know, it's the only other conference that I really get useful things out of each time with it. I find a doctor who wants to that. And the other thing is, ask your local compounding pharmacist or your doctor friends, you know, who are they using, who are they going to? I mean, you know, it may take a little effort, but you should have an independent person do this. You shouldn't be doing this.
You know, the choir right away chanted out sea salt. Are you in agreement with that? Because I'm not.
All salt could be sea salt. So sea salt means nothing to me. The proper terminology for salt is refined and unrefined. So refined salt is sodium and chloride with some toxic chemicals added to it. Unrefined salt has no toxic chemicals added to it. It has the minerals in it wherever the salt is harvested from. I've tested 3 brands. I've tested Celtic salt, redwood salt, and Himalayan salt 4 times. They've all tested with good mineral content load and no metal toxicities to it. The best of that lot is Celtic salt. Celtic brand salt. You know, Selena's, I think she changed the name of the company now. And however, all 3 were fine.
Even though the Celtic salt and the sea salts have higher levels of arsenic, much higher than the other refined salts.
It has what's in what's in that water. When I tested, the arsenic levels were very low. All the 4 times I tested those salts. I haven't tested it in a few years. That was a few years ago.
Okay.
Debbie, what this is the last question, and we'll get right to the party.
Just the general panel, a consensus, if there is one. When removing mercury and amalgam, you often get asked, how long do I wait before I get pregnant? And how long do I wait before I nurse? So if they've already had a baby, they want to get the mercury out, and they're nursing, do you interrupt that process for X amount of what?
I might say, in response to your comment to get them out whenever, I would say if she's talking about if she's pregnant, I might do some testing and see if the mercury levels aren't testing high. I don't know if I would wake that sleeping dog there. And I would probably vote to let the sleeping dog lie and deal with it after pregnancy. Best idea is deal with it before the pregnancy. How long to wait? I would test for it and test to see the levels are down. And or whatever test you're going to use, whatever test you think is valuable, whether it's hair, urine, blood. I don't think blood's that valuable, but challenge test, however you're going to do it to get to that point. And look, I see them when they get the fillings out from the dentist, mercury levels usually go up, and you can follow that down over time.
And the nursing thing.
Pardon me?
The nursing part too. If they're nursing and they want to get the mercury out, you take it out. How many days should they?
I don't recommend doing while they're nursing. I would let that sleeping dog lie again and deal with it afterwards. Unless for some reason levels are sky high. I don't even know what I would. I don't think there's a defense if there's a problem, and you're doing this while they're nursing or pregnant. I don't know. I just think you're going to release more into it.
Some time ago, a member of our academy, Wayne King, did some of that work when he was testing breast milk. And if I remember right, Dave, I don't know if you remember it, but he said at least 2 days after you take the breast milk, and they could pump and they'd have some decent milk beforehand. So by that time, after a couple of days, it seemed like it came back down to a better, whatever that means. But you might want to contact Wayne.
Give the entire panel a comment on the question, please.
I don't have an answer to that question, but I have a story I'm dying to share with you. because it might throw some light on me. I was invited to go to Israel to talk before the Knesset on water day. And whilst I was waiting to go in, this fellow walked up to me and said, "You must be Dr. Conant." I said, "Yes." He says, "I'm Ted Trojinski, Dr. Ted Trojinski, and you're against fluoridation." I said, "Yes." He says, "I'm for fluoridation." His next question, "You against vaccination?" I said, "Well, I'm not against vaccination per se, but anybody that injects organic mercury into a baby's bloodstream should be put in prison." There the conversation ended. Now, I gave my testimony before this committee. As soon as I finished, up jumps Ted and says, "If you let these people from America come over here and tell you that fluoridation is a bad idea, they're going to come over and tell you that pasteurization and vaccination is a bad idea. And by the way, this man is against vaccination." So I said, "What? I did not say I was against vaccination. I said I was against the injection of organic mercury into baby's bloodstream." 2 days later, I speak at his university, same thing again. "This man is against vaccination." I said, "I've told you twice. I'm not against vaccination. I'm against the injection of organic mercury." 2 days later, I speak in Tel Aviv City Council. Ted does it for the 4th time. Now, me thinks he was trying to tell me something. There's a happy ending to the story. In August of this year, fluoridation was banned in Israel. And one of the, one of the experts who was really going after and chastising the Minister of Health, who was going to bring in the end of mandatory fluoridation. They organized the dentists and everything else, and with the help of the Jerusalem Post, they attacked her. They attacked her personally. And Ted Trojinski was one of the people quoted in the press. We, on the other hand, we mobilized, and some of you may have signed it, a letter to her saying, "You're right, and keep going." Well, the end result is, I think she was so teed off with this personal attack, so she didn't just stop at ending mandatory fluoridation, she ended it completely. I thought you liked that story.
Thank y'all for the panel, and let's get ready for the party.